Today we will discuss about the myocarditis. Anyone in the class know about myocarditis?
Yes, ma'am.
Arsh?
Myocarditis is derived from the two words myo and itis, where the myo means the middle layer of the heart myocardium and itis means the inflammation. So myocarditis can be defined as the inflammation of the myocardium, the middle layer of the heart.
Myocarditis may be acute or chronic. So it is an inflammation of the myocardium. Is characterized by the inflammatory cells infiltrate, myocyte necrosis or myocyte degeneration. Myocyte degeneration means declined myocyte cell functions, and the myocyte necrosis means the death of the myocytes because due to the lack of the blood or oxygen. Clear it? Everyone is clear?
Yes, ma'am.
Anyone in the class know in which way myocarditis occur?
There are several causes of the myocarditis. The main cause of myocarditis is the infection, which is caused by the herp virus, SLE, systematic lupus erythrocytes, flu, adenovirus, and certain side effects of the medication such as antidepressant medications and antibiotics.
Okay, everyone is clear about causes of myocarditis?
Yes, ma'am.
So the main causes of myocarditis is unknown. These include this may be myocarditis may be caused by some flu, herpes virus, adenovirus, coccidiovirus, parvovirus, and SARS-CoV. Then other causes of myocarditis include bacteria, fungi, rheumatic fever, or some autoimmune diseases like a rheumatoid arthritis or lupus. Myocarditis may be caused by some side effects of some medicines. These medicines include antidepressant, seizures, antibiotics, medicine for weight loss, diuretics, and benzodiazepines. Clear?
Yes, ma'am.
Next is the clinical manifestation of the myocarditis. So anyone know if the patient is suffering from myocarditis, then what are the main symptoms shown by the patient?
Shortness of breath, fever, tachycardia, dyspnea, and abnormal heart rate.
Next is the clinical manifestation of myocarditis. So first one is the shortness of breath, worse when lie down or in a prone position. Then is the tiredness, fever, especially when infectious. If the myocarditis is caused by the bacteria, then especially a parvovirus B19, and then it may be causes a fever to the patient. Then is the chest pain, sharp or stabby in nature. Then heart palpitation, feeling like heart is beating forcefully. Then abdominal pain, lightheadedness, abnormal heart rhythm, loss of appetite, and swollen legs or edema. Other symptoms is fainting and dizziness. This occur because of it can reflect inadequate blood flow to the brain. So that's why the patient may suffering from faint and dizziness. Then is the damage to the heart cells. These symptoms we can see when there is an elevation of the troponin and inflammation. Everyone is clear about the clinical manifestation of myocarditis?
Yes, ma'am.
Next is the pathophysiology of myocarditis. Due to etiological factors, there is an inflammation and injury to the myocardium. Then it leads to decreased myocardial contractility and it causes the heart enlarge. Due to the enlargement of heart, it may decrease the cardiac output. So it leads to the myocarditis because there is increase in the sympathetic tone, and if it not treated properly, then it may cause a congestive heart failure and the sudden death of the patient. Everyone in the class understand the pathophysiology of myocarditis?
Yes, ma'am.
Next one is the diagnostic evaluation. Anyone in the class tell me which diagnostic evaluation is performed for the patient who is suffering from myocarditis? Simar?
Physical examination, medical history, endomyocardial biopsy, ECG, echocardiography, cardiac enzyme test to check the elevated level of troponins, CK, creatinine kinase, aminotransferase, lactate dehydrogenase.
So next one is the diagnostic evaluation of myocarditis. In myocarditis, firstly we take the history of the patient. Clear? And then we can perform the physical examination of the patient. in which we observe the abnormal heart rate, fever, tachycardia, and edema in legs. Besides this, there are some blood tests which helps to diagnose the problem of myocarditis. Like we can check the erythrocyte sedimentation rate of the patient, cardiac troponins, and creatine kinase MB. These are the cardiac enzymes, and in case of the myocarditis, maybe the level of this enzyme is elevated. Clear? Yes. So next one is the electrocardiography. ECG tests show the sinus tachycardia with non-specific T wave elevation. You can see in the picture. Then is the chest X-ray. Chest X-ray show the size and the shape of the heart as well as the lungs. A chest X-ray may show the accumulation of the fluid in and around the heart that might be related to the heart failure. Okay. Next one is the MRI, cardiac MRI. Cardiac MRI show the heart size, shape and structure. And it can also show sign of the heart muscle inflammation. Then is the echocardiogram. Echocardiogram show the heart size and how well blood flows through the heart and the valves. Clear? So echocardiography is the one of type of an ultrasound in which we can see the flow of the blood in the heart and the opening of the valves. Clear?
Yes, ma'am.
So next one is the cardiac catheterization. So cardiac catheterization is a procedure in which a thin flexible tube catheter is guided through a blood vessels to the heart to diagnose or treat certain heart condition such as a clogged artery or irregular heartbeats. Next is the medical management of the myocarditis. In the myocarditis, we given the patient ACV inhibitors. Anyone tell me about the full form of AC inhibitor? AC inhibitors, the definition, angiotensin converting enzyme. There is a one of example that is the captopril and lisinopril. Then we can give the beta blockers to patient, that is the metoprolol and atenolol. Then diuretics. Anyone know about the types of the diuretics? Diuretics such as a furosemide given to the patients to reduce the swelling because there is a presence of a swelling in the legs. So that's why we give the diuretics to the patient so swelling will be reduced. Then is the antiarrhythmic drugs such as the adenosine or carvedilol. Then digoxins, it works by affecting certain minerals such as the sodium and potassium inside the heart cell. This reduces strain on the heart and helps it maintain a normal, steady and strong heartbeat. Okay, next is the oxygen therapy. If the patient is shortness of breath, then we can give the oxygen therapy to the patient and antibiotics drugs. Antibiotic drugs are given to the patient just to reduce the infection because if myocarditis is caused by a bacteria, then there is a chances of the fever. So antibiotic is given to reduce the infection. Then NSAIDs to reduce the inflammations. Clear?
Yes.
Medical management of myocarditis. First one is the
ACE inhibitors.
So what is the function of AC inhibitors? It stop the angiotensin converting from angiotensin 1 to 2. Clear? So in this way it reduces the BP of the patient. Clear?
Yes,
Because in the myocarditis blood pressure is increased, so with the help of this AC inhibitor it reduces the BP of the patient. Next is the beta blockers. So what is the action of beta blockers? Slow down the heart rate. Clear? Yes. So beta blockers basically slow down the heart rate as well as. So what is the effect of beta blockers? Anyone in the class?
To slow the heart rate and maintain the blood pressure.
Clear?
Yes, ma'am.
So next one is the diuretics. What is the function of diuretics?
Helps to reduce the swelling.
Next one is the antiarrhythmic drugs. What is the purpose of antiarrhythmic drugs? To maintain the normal rhythm of the heart. Next is digoxins. What is the purpose of digoxin drugs? To reduces the strain on the heart and helps to maintain the normal, steady and strong heartbeat. Next is oxygen therapy. What is the purpose of oxygen therapy? Anyone in the class? Next is the antibiotic. Why we give antibiotic to the patient who is suffering from the myocarditis? To treat.
Infection.
Next one is,
Disease.
what is the purpose of NSAIDs?
Inflammation.
Okay, very good. Next is the complication of myocarditis. First one is the cardiomyopathy. In cardiomyopathy, the heart muscles weaken or the structure of the heart muscle changes. Next complication is pericarditis, in which inflammation of the sac covering the heart called the pericardium. Then third one is the atrial fibrillation, is an irregular and often very rapid heart rhythm that can lead to blood clots in the heart. Next is the sudden cardiac death. Sudden cardiac death is death due to the cardiovascular cause that occurs within 1 hour of the onset of the symptoms. A sudden cardiac arrest occurs when the heart stops beating or is not beating sufficiently to maintain perfusion and life. And the last one is the multi-system organ failure. Multi-organ failure is a severe life-threatening condition that usually occurs as a result of major trauma, burn or fulminant infections. Clear?
Yes.
So these are the complications. Next is the nursing management. So if the patient is suffering from the myocarditis, firstly, we assess the vital sign, assess the other clinical symptoms such as the chest pain and heart rhythm, monitor the breath sounds, respiratory rate, pattern, oxygen saturation. What is the normal value of oxygen saturation? Next, assess the peripheral pulses and assess the nutritional status of the patient as well as the level of anxiety. So this is the nursing management of the patient. Next is the nursing diagnose. Ki banega first nursing diagnose? Anyone in the class? Okay, as you know, the patient, the main clinical symptom is also fever, because if myocarditis is caused by any bacteria, then obviously the patient is suffering from fever. So firstly, we can maintain the body temperature of the patient. So the first diagnosis, impaired body temperature related to inflammatory infectious process as manifested by checking the vital signs. Next one is the pain. Pain related to inflammation of myocardium as manifested by the verbal talk with patient. And the third one, diagnosis, decreased cardiac output related to decreased cardiac contractility as manifested by the tachycardia or ECG changes. Then imbalanced nutritional status, less than body requirement related to loss of appetite as manifested by intake output chart. And the last one is impaired sleeping pattern related to chest pain as manifested by the light-headedness and redness or swelling of the eyes. Clear? So this is the main nursing diagnosis. So according to the nursing diagnosis, you can give a care to the patients and maintain your goal. Clear?
Yes, ma'am.
Everyone is clear about myocarditis? Yes, ma'am. I summarize the topic. Myocarditis, definition of myocarditis. It is defined as the inflammation of the heart muscles, myocardium. So it is characterized by the inflammatory cell infiltrates, myocyte necrosis or myocyte degeneration. Then is the causes is adenovirus, Coxsackie virus, bacteria, rheumatic fever, autoimmune diseases like rheumatoid arthritis, some side effects of the medicines like antidepressant drugs and seizures drugs, antibiotic. Then there is the clinical manifestation of these conditions is the shortness of breath, tiredness, fever, chest pain, heart palpitation, abdominal pain, lightheadedness, abnormal heart rhythm, loss of appetite, swollen legs or feet, fainting and dizziness, damage to the heart cell. So next is the pathophysiology. So due to the any etiological factor, there is the inflammation and injury to the myocardium. It decreases the myocardial contractility. It leads to the heart enlarged and decrease the cardiac output. Then is the diagnostic evaluation. We go for the physical examination, medical history of the patient, blood test, ECG, chest X-ray. cardiac MRI, echocardiogram, cardiac catheterization, and then is the medical management. In medical management, AC inhibitors like captopril, lisinopril, beta blockers, diuretic drugs, antiarrhythmic, digoxin, oxygen therapy are given to the patients to recover from this problem. Then there are some complication of this disease like a cardiomyopathy, pericarditis, atrial fibrillation, sudden cardiac death. Then is the nursing management. Everyone is clear about this?
Yes, ma'am.
Anybody have any doubt in the class? No, ma'am. Now it's the time for the recapitulation. Now it's time for recapitulation. Define myocarditis. Sukhman.
It is defined as the inflammation of the heart muscle. It can reduce the ability of the heart to pump.
Very good, Sukhman. Next, define the sign. Anyone is in the class, tell about the sign and symptoms of the patient.
As in grief, tiredness, palpitation, fever, swelling, etc.
Very good, Jashan. Next is the diagnostic evaluation of myocarditis.
Diagnostic evaluation of myocardium, physical examination, check the previous medical history of the patient, then chest X-ray, MRI, cardiac MRI, echocardiogram.
Very good, Sulakhan. Next is the medical management. Harpreet, tell me the medical management of myocarditis.
The medical management of the myocarditis is ACE inhibitors, digoxin, antiarrhythmic drugs, antibiotics, diuretics such as furosemide and torsemide, oxygen therapy, and NSAIDs.
Next, what is the complication of myocarditis?
Cardiac myopathy, pericarditis, atrial fibrillation, sudden cardiac death, and multi-system organ failure.
Everyone is clear about myocarditis? Yes, ma'am. Okay. So myocarditis is defined as the inflammation of myocardium, the middle layer of the heart. Okay.